this video, I'm going to run you through the parts of the biggest, the strongest, the longest bone in the body, which is the femur. Okay, femur, very, very large bone, as you can see. It is very, very obvious to see just based on its size, but also the presence of its very, very rounded ball-like head, which is one of the structures that you have to know about it. Now, along with that, I'm going to help walk you through understanding what's anterior, what's posterior, and being able to determine the right and left sides, or the difference between a right femur and a left femur. So, first thing to do is to figure out what is anterior and posterior. Right now, it is laying up in an anterior position, so what we're seeing here is anterior. I can tell you that right away because of what's going on down distally at the knee. On the posterior surface of the femur is a very, very pretty good sized deep depression, which is called an intercondylar fossa. That's a very important site that helps to kind of form the knee joint along with the ACL and PCL that attach the femur to the tibia. Okay, so now we know this has to be posterior. This side, which has this, what we call trochlea or patellar surface, is always going to be anterior. The next thing you can do is go back proximally and find the head. The head is always going to have to point medially so that it can insert itself into the acetabulum, that socket that's found within the hip bone. So this is medial, okay, which means that this, if I turn it around, face away from me, cannot be a right, because that would point it out laterally. This would have to be a left femur, okay? So now we've got the difference between anterior, posterior, as well as left and right, and, you know, medial, lateral. All right, so we'll start back up here approximately. Once again, here's our very large rounded head, okay? For the first time, you are able to see the fovea capitis. Fovea capitis is a small central depression or pit that's an important site of ligament attachment for ligaments holding the hip together. So it's just this little depression that's found on the tip of the femoral head. Okay. Now if I turn it sideways here, we get a good look at the constricted portion just distal to the head, which is the femoral neck, or just neck, okay? And then if I turn it around here anteriorly again, we can see a large bump on the lateral side, which is the greater trochanter. And then if I peek it around just a little bit medially here, and really very visible in the posterior view, is the lesser trochanter, okay? Now, between those two structures, we've got an intertrochanteric line and an intertrochanteric crest. So you have essentially the same structure, a crest versus a line, okay? One is posterior, one is anterior. Now, right now I'm looking posteriorly. Once again, there's my intercondylar fossa. So since I'm on the posterior side, I'll go ahead and point to it, which is the intertrochanteric crest. Basically, it's just this line that's running between the greater trochanter over here to the lesser trochanter. Okay. If I flip around back to the anterior side, it's not very prominent in this model. It does show up a lot better when you look at the real bones. But the intertrochanteric line, which is on the anterior surface, would run from the greater trochanter across down to the lesser trochanter. Okay, so the intertrochanteric line, posterior side would be the intertrochanteric crest. Now, if I move distally along that posterior surface, I will see kind of a pretty prominent ridge that runs all the way down, almost completely distally to the knee. That posterior prominent ridge is an important site for some of the hamstring muscles to attach, and that is known as the linea aspera. Okay. Now, when I get distally down here to the end of the femur, you can see two rounded knobs. These are going to be much more visible on the posterior surface than they are on the anterior side. So we'll look posteriorly here to show those off. We have a medial and a lateral. Now, we already learned that the femoral head is always going to be pointing medially. So that means we've got right here the medial condyle, and that makes this the lateral condyle. Those are important for providing kind of a nice rounded surface so that we can flex our knee, because these are going to articulate with the medial and lateral condyles of the tibia. Thankfully, we have a medial and lateral meniscus, a piece of cartilage that helps to prevent those two bones from really kind of slamming into one another. We already talked about this, which was the intercondylar fossa. Remember, inter means between, so that's why it's known as an intercondyle or intercondylar fossa. Okay. Now, you don't want to get condyles confused with epicondyles, which are going to be bumps on the sides of our bone. We just talked that this was the medial condyle, so that makes this the medial epicondyle. This is actually where the MCL ligament, the medial collateral ligament, attaches above the knee and then runs downward to the tibia to connect to it on its medial epicondyle. Okay, here's our lateral condyle. So on this side is our lateral epicondyle. Lateral epicondyle is the site of attachment for the lateral collateral ligament, which runs from the femur down to the head of the fibula. Okay, that's why it's also known as the fibular collateral ligament, whereas the medial collateral ligament is also known as the tibial collateral ligament. I already discussed this little surface here, but once again, that is the trochlea or patellar surface, which is where the patella would sit and form the tibiofemoral joint, which is not your knee joint, but just the 2 points or the point of contact between the femur and the patella. Okay, so that is the structures of the femur. Thank you.